ABC15 Facebook page. We will see you there.
Good morning, everyone. I'm Karla Navarrete with ABC15. To my left, Kaley, my partner in crime, and then to my bottom is Will Humble. He's a former director for Arizona Department of Health and Human Services, and then over below Kaley is Jamie Clemens. She's with the Mesa Public Schools. Jamie, if I may ask, what school are you at in Mesa Public Schools?
I am at Edison Elementary.
Edison Elementary, very good. So thank you all for joining us this morning. We have a lot to cover. Kaley and I have been preparing all morning long. Thank you to our guests for being here. I'll go ahead and start off with the news this morning of the state benchmarks as far as schools are concerned. And Will, if I will start with you, have you taken a look at them this morning, and what has been for you the most important takeaway from these benchmarks for this week in comparison to maybe last week or the last couple of months?
Well, to be honest, it doesn't really matter which county you look at. They're all headed in the same direction, which is more towards substantial spread for the metrics that really matter. So those of you that are looking at that school dashboard, the two of the metrics are useful, which is the cases per 100,000 and the percent positivity. My advice to viewers and family members and parents and students is to ignore the COVID-like illness metric because it is deceiving and, in my opinion, unimportant. So if you look at the important metrics, cases per 100,000 and percent positivity, all of them are, if they're not in the substantial range, they're headed there. So that's my assessment. I'm not surprised because if you look at the weekly updates that I get from my colleagues at the U of A, they paint a similar picture, but it's more updated data. The dashboard data at the State Health Department is lagged by 12 days. And so when you look at more contemporary data, it's easy to see where the trends are going. And it's, quite honestly, it's not looking like we'll be in-person instruction hardly anywhere after Thanksgiving.
But you bring up a good point, though. Some districts are still remaining on in-person learning. Jamie, I see you nodding your head. It looks like some schools in Mesa are continuing to do in-person learning. Is that correct, Jamie?
Yes, at this point, our district in Mesa has decided to have it be a remote day the Monday after Thanksgiving, but that is all we know at this point. I know my principal is meeting with his administration, I believe tomorrow, maybe to look since these benchmarks have come out. But right now, you know, they're still wanting kids in school, which we certainly understand, but with being substantial and our whole district being red, it's a big concern.
So we're going to show you some of those latest numbers. We sent them over to our production team earlier this morning. It shows the difference. And I know, Will, you mentioned that these numbers are lagging, but for right now, let's use those. Last week on October 25th, the numbers were 133 cases per 100,000. This week, November 1st, the numbers are 212 per 100,000. We're talking about an 80 case difference, something that we haven't seen go up that drastically in the last couple of months. Where are we going to be on November 8th or 9th of next week? Well, what do you think those numbers will be?
Well, they all got worse. I can tell you. I mean, the data's already in. It's just not updated on the state's school dashboard because they lagged their data by 12 days. And, you know, the last 3 weeks have been what's called exponential growth in cases. So it's no longer linear. We saw linear increases in cases in October, and it began to become exponential in November. And that exponential just means that it's a log scale. It's increasing far. It's like 1 + 1 = 8. So, you know what I'm saying? It's going up very quickly.
Can you talk about why? Because, I mean, I'm watching the chat here. We've got a lot of parents saying, come on, it's not in the schools. So can we address that? Because we've got a lot of parents here who have jobs to go to. And I mean, we don't want to put jobs before lives, but we definitely need to talk about this issue.
Yeah, well, so let's talk about it broadly. And I've had a lot of district folks ask me and superintendents even about what I think. And to me, the community metrics are one piece of the puzzle. I think of it like a three-legged stool. One of the legs of that stool are the community metrics, and that's what we've just been talking about for the last couple minutes. Another leg of that stool is how successful your school, either school or district, has been with mitigation measures. So, for example, when you get a case in a school, and parents identify a student as having COVID-19, do you get a large number, a cascade of new cases as a result of that index case? Or are the mitigation measures that you have in place stopping the spread within the school? So it's not just community metrics that matter. It's how effective have your mitigation measures been throughout the fall? So they should take that into consideration too. It's not just community metrics, the cases per 100,000. It's how well has your mitigation plan been working? And then finally, just listening to parents, teachers, staff in the community and looking and asking, getting their input about what's most important, and then looking with respect to the type of school, and then looking at the demographics within your district and taking that into consideration. So for example, some districts are in areas where all the students at home have Wi-Fi, easy access, computers, they could do distance learning. Other districts have it so that it's far more challenging and those kids don't have the resources at home. Likewise, take a look at what the demographics are in your district. How many multi-generational families are there? Because that's something to think about, because the students could be bringing the virus home and then not just giving it to their parent who's in their 30s or early 40s, but to their grandparents who might be in their 70s. So it's not just community metrics. It's the success of your mitigation plan thus far during the semester, and then demographics, and quite honestly, the opinions of the parents and teachers in the district.
How are things going, Jamie, at your school at Emerson? How do you see the puzzle, the greater puzzle, fit into your particular school?
Here at Edison, our principal is following the district guidelines. We have had cases, and we are following all the measures that they want us to do to prevent the spread. And I think they're feeling confident, but I just heard of an elementary school in Mesa that went to remote starting today. Because at first we didn't know if it would be a whole district thing or if it would be school by school. We haven't really been informed how they're doing that, but now we know it's school by school. So with the cases that we have, we will follow all that we need to. The concern too is sometimes that some of our families aren't going to get the kids tested. So if they go to the nurse with symptoms, they're just going to be out, quarantined for the 10 days and then just come back. So we don't really know. So it's hard to feel good about knowing if the data is 100% accurate on our own district, dashboard.
Mm-hmm. And what do you think, Will, about that, going to school, doing a case by case basis as opposed to the entire district going to virtual? It seems like Mesa's heading that way with Sousa Elementary going virtual starting today. It seems like they're kind of going by a microscopic view of that actual school and those who live in that school, as opposed to a blanket, cover all the Mesa public schools.
Yeah, no, I think it's smart to look at it in a granular fashion like that and take a look at, because look, different schools can be at different levels in terms of their success depending on their staff. I mean, everyone knows not everyone has the same level of expertise and diligence when it comes to this pandemic. And it could be that there are some schools that have a terrific school nurse, for example, who's really on the ball and on top of the contact tracing and eliminates the cascade of cases. Other schools might not have that kind of resource in place and therefore are at higher risk for internal spread. And so I think it makes sense. And one more topic, and maybe we'll get into this later, but I think it also makes sense to look at the grade levels. I mean, from what I'm hearing, the real issues are in the 9 through 12. It's in the high schools where the biggest spread is. And look at that and say, hey, look, high school kids who are taking, English, biology, Spanish, chemistry, those types of classes are more amenable to distance learning, and they're more mature. They're close to adults when they're seniors, and they're better able to benefit from in-person learning relative to, say, third, fourth, fifth. Jamie, like what the elementary kids learn a lot better in person. And so I think there should be more focus on grade levels, not just the metrics, but look at risk and benefit. And what I'm hearing is that the bolus of cases are really high school cases more than elementary.
Do you think that has to do with the mask that, I mean, Dr. Karakris was talking about this today, and being more stringent on, I don't know if it's placing limits. I mean, how do you make sure these kids actually wear a mask appropriately? I want to get into the emotional aspect of this here in just a moment, because some of these comments and parents, we so appreciate you chiming in. I think it's really important in terms of keeping the conversation going. But Will, I want to go back to this mask thing. I mean, you know, I have little kids. They're scared to death to take their mask off, right? But they're still in that rule following structure mode, right? That's not going to be the case for high school kids, and that's just human nature.
Right.
And
we
fight a lot with elementary kids too, of not keeping it on or wearing it.
Okay.
We fight with them all day.
Really? Okay. So it's also a problem in the elementary schools, but do you see that it's a little bit more, you know, you're able to control it a little bit more, whereas high schoolers, you know, they're like you said, Will, they're close to adults, and we know
set in their ways.
Right.
I think so, because, you know, they have a lot of adults telling them all day long, wash your hands, put your sanitizer on. Yes, keep your masks on. You're right. We do have that as a plus for us. But like I said, a lot of them, you know, don't wear them or take them off or doing this or that. So, you know, it's a struggle every day.
Yeah.
Keep them on.
Well, go ahead.
I just want to say, you know, biology is part of this too. It's not just the behavior, but the biology, because there's some pretty good evidence that the smaller children, number one, are far less likely to even be symptomatic, even if they are infected. And also good evidence that they shed the virus less. So biology is part of this too, in that as the students get older and approach adulthood, say 16, 17, in that age range, they're still at low risk for bad complications. But the biology suggests that they begin to shed more, which means they're sending it more to their peers and potentially, obviously, their teachers.
Can we talk about the psychology here? In fact, tomorrow morning on ABC15 Mornings, I'm going to be sharing a story that I did at Palomino Palomino Intermediate. It's in the Paradise Valley Unified School District. And there's a teacher there, Charlie Jones. She's an art teacher. And I mean, we were both shedding tears together about the emotional aspects of this. I mean, in some cases, we've got kids coming from very challenged situations at home. And right now, let's just get very real. What home isn't challenged right now? I mean, a lot of us are just sick of each other. We want something different, right? I mean, I'm going way real here. It's hard. The struggle is real, regardless of what's going on behind the scenes at home, right? But we've got varying levels. And the story that I'm talking about tomorrow is talking about kids who are considered at risk. They've got this outlet in a classroom, and it's an art space, and all these kids are feeling involved, and they're championing behind this project, and it's wonderful, but now bittersweet tomorrow, because it's the last day they're going to be together until who knows when, right? And so as parents, you know, we hope for structure. We want our kids to be emotionally engaged in something and feel connected to something besides, like at my house, video games, right? So what do we do with that? Because that's real.
It's a real struggle, and I'm so glad you said that. There is not a family that isn't affected by this in so many different ways. We're seeing it in the schools, and it's coming out now even more, the thought of even just being home for a holiday, you know, because of right now they're not saying that we're going to go remote, but it's a big struggle, and I'm dealing with it every day. I get emotional every day. You want to go in and help all these families. I think the thing to do is just, you know, talk about what we can control, what we can't control. Self-care is huge. You know, watch the news, but don't watch it all day long, you know. Stay away from the media, the social media. Try to have everybody, you know, have their own space so that they can cope, and everybody have a little grace with each other right now, because everybody's fuse is about this big right now. And we get it. And it's taking a toll. And, you know, I say this a lot. We're going to be paying the consequences for this for a long time, but it's out of our control. It's a pandemic, and we can't control it. We have great news coming on the front with the vaccines, which is positive, but it is a constant struggle. We need to take care of each other, listen to each other, be kind. We're seeing it in elementary schools, which are a big reflection of what's going on in families.
And Jamie, what are the kids telling you? What are they sharing with you? What is their number one worry? Are they anxious? Are they depressed? Or what, if you could sum it all up for us, what are they telling you?
I think they're very anxious, and I think a lot of it comes to someone in their family dying.
Yeah.
I think it is really about that, because my co-counselor and I've kind of talked to him about it a little bit lately, like, how are you feeling about this? And they're kind of at the point where they understand it could be severe enough that they'd have to go remote again, but of course they don't want to. And there isn't an educator in the world who would say that remote is better than in person, and especially for the emotional part of it. Being in person is much better, but they understand if we have to take care of ourselves and our families. But they're anxious, and it's coming out. We're starting to see more fighting with the kids and tears and just not coping well, and it's just heartbreaking. We're just taking one kid at a time and doing everything we can. And little perk for Mesa, we've really increased our counselors. So I have a full-time counselor here at my school for the first time, and we're getting to do so much, which is fabulous. But everybody needs support, and get help if you feel like it's crossing where you might jump off the bridge a little bit and you're going down too far. We need to be able to get help for that.
Mm-hmm. I know that one of the things that we're doing here at our house is we're doing art therapy. And so, I'm just trying to do whatever I can think of that can get their little minds off of COVID and off of, this emotional turmoil. Even if it's for 45 minutes, I think it's better than nothing. And, my daughter I'll share something personal. My daughter this last weekend, my husband had to go out of town, and she just bawled. It was like, honey, he's just going away for 2 days. And it's funny what you were saying, because that's exactly that was her fear, that she wasn't going to see her dad again. And I'm like, Dad's totally fine. We're all good. But in her little 9-year-old mind, the thought of Dad going away for a day or two is enough to trigger an emotion of like, am I ever going to see him again?
Yes.
What are some of the things that we can say to our kids when things like this happen?
I think it's really good, depending on the age of the child, but I think it's really important to acknowledge how difficult that is. Maybe relate it to something else difficult your families had to go through, and what you did, and what strategies and plans you used to help you get through it, and how we can use those strategies again. We're all in this together, and we're really not, we're not going to stop and change it, but we can talk about it and give them a very safe space to share whatever they're feeling, whatever that is. And I just think validating, and I just think it's so important we have that self-care every day, whatever it is.
Okay.
Anything.
And Karla, you said great. It's so important. Mm-hmm. Right.
Anything. I don't know. I'm not a counselor. I'm not an expert, but I'm a parent, and so I'm like, I know that art for me helps me kind of deep, and I've tried breathing deeply just to kind of get their mind off of things. Will, anything from you as far as how to help our kids cope through all of this?
I think I can't beat what Jamie said. She's an expert on kids, so I'm more of a scientist type guy. But I think she did a nice job.
Go ahead. I'm sorry.
No, go ahead.
No, you were on a roll. Do it.
I wanted to bring up what education director Katie Hoffman brought up yesterday. She said something on her Twitter account that I was like, wow, that's really impressive. She said, schools should be the last institutions to close, because so many kids rely on the schools as that safety net. Kaley, what you were saying earlier, kids that come from vulnerable homes, kids that come from abused homes. But
kids who need to eat.
Exactly. School is their way of getting fed. And so, but at the end, her last tweet was, the bottom line is more aggressive action from the state is needed. She said, in order for leaders to be able to count on keeping those schools open, they need to be able to count on their state leadership. back to you, Will, with that statement. It's saying a lot. And she put this out right after Governor Ducey had his press conference where, we know that he did not enforce a state mask mandate. Can we go back into that? And what kind of message does that send to the public when there is no state mandate? Although we know that so many cities already have one. What does that mean in terms of just sending a message?
Yeah, well, obviously, it's a really important issue. Here's the thing. Yes, it is true that there are local ordinances in place, but it's a hodgepodge of different ordinances that read differently, so people don't know what the rules are from city to city. But more to the point, there's not a consistent compliance and enforcement mechanism in place across the state. So to me, it's not so much that the 10% of the population is left out, but rather the fact that it's not a uniform standard and it doesn't have consistent and enforceable criteria built into it. I'll give you an example. Many of these local, if not all, the local ordinances are individual mandates for individual people to wear masks. What makes a lot more sense to me is to have a statewide mask mandate that says, and you as an organization or a business are at risk if you allow your customers or people that use your property to not follow the mitigation measures. And the risk is on you as a business, not the individual people, but the business itself. And so in that way, you could use like a hub and spoke type enforcement mechanism so that the grocery store is held accountable for the customers that come in, and they have to ensure at the store that people are wearing masks. And if people aren't wearing masks, the store is held accountable. So you see what I'm saying? You've got to have an enforceable system that works, that leverages merchants to get compliance. And that's not what we have. We have a patchwork of ordinances that are hodgepodge, different in every jurisdiction, and mostly individual person by person mandates, which to me is super ineffective. But I want to touch on one more thing,
okay,
which is that another really important aspect of this in terms of the public policy is that if you remember, the governor put a pause on the bars and nightclubs and asked restaurants to go to 50% capacity several weeks ago. But when they transitioned, they allowed them to sign attestations that they would follow these mitigation measures. Well, that's good. I think they were good standards that were put in place. Restaurants at 50% as an example. And bars have to operate like a restaurant, also at a lower threshold. But there's a complaint hotline, but there's no real proactive compliance and enforcement system in place. And that's been a real shortcoming over the last couple of months. And so I challenge any of you that are watching, go out on the weekend and look at what the bars, the sports bars, and the restaurants look like. And look at the parking lots if you don't want to go inside. You can see they're all at busy capacity limits, and the compliance and enforcement isn't there. So what we have needed for many weeks now is an organized compliance and enforcement system. And you can use a workforce. They're called sanitarians. The people who do the food safety inspections out at the restaurants could be repurposed to focus solely on proactive COVID-19 mitigation at the bars, restaurants, and nightclubs, and revoke food establishment licenses of those businesses that don't comply. Well, we don't have that kind of compliance system. And as a result, we've got these crowded indoor environments where people are not wearing masks. The science is now telling us that is precisely the environments that amplify this virus. And yet we have a complaint-based system where, by the way, I've heard many of the complaint investigations are just phone calls. So it's a big shortcoming. And had we been doing better compliance and enforcement 2 months ago, we'd be in much better position, not just in the schools, but within, and I know this show isn't about hospitals, but we are facing, in my opinion, a hospital crisis probably around December 10th to 15th.
Okay, so, you say that, and we've got a lot of doom and gloom here, okay? We know a lot of it is because of fatigue. It's because the bars are busy because people just don't want to be home. They're mad. We're all pissed. for lack of a better word. I mean, this is not easy. So we've got these vaccines. There were 2, maybe 3 as of overnight this morning when I was reading everything to get ready for the morning show today. I mean, is that what we're leaning into, Will? I mean,
oh yeah.
I mean, how in the heck are we going to get out of this?
It's the vaccines. I mean, that's it.
That's the answer.
And listen, I just said some stuff that was probably not uplifting just now.
No, but we have to be real about it.
But the vaccine is a shining light. I will tell you, the Pfizer and the Moderna vaccines are finishing phase 3 trials now. That's the final clinical trial. Those trials were suspended hardly at all during phase 3. Mm-hmm. Both say they're more than 90% effective. They haven't submitted to the data to the FDA yet. But these, by the way, it's a new kind of vaccine called messenger RNA vaccine. So will be probably safer and fewer side effects than typical vaccines. It's really, I'm so encouraged by the results of the last 10 days. They were just press releases from those 2 companies, but I've got to believe they can back that up with the real data in phase 3. And there are 11 vaccine manufacturers in phase 3 trials right now in the US. Pfizer and Moderna are the closest. AstraZeneca's not too far behind, and there are others. So 2021 will be there's going to be a lot of logistics issues with getting this vaccine out because we have to vaccinate probably 5 million of the 7.2 million people. That's no easy thing. But the vaccines are going to get us out of this, in my opinion.
But what about the people? Because I'm watching this chat, okay? I mean, you got people saying, oh, no, I'm not taking that vaccine. Well, I've talked to you live on the air, Will, and I've asked you point blank on live television, will you take it? And you emphatically say, yeah.
I would take cuts if I could. Oh, I signed up for the clinical trials. I didn't get picked. No, I'm a huge believer in vaccines. It's the number 1 public health intervention of all time.
Yeah. Wow. Now that's a statement because you've been in public health for decades.
It's changed our world.
Yeah.
If any of you that still have grandparents who are in their 70s, 80s, 90s, and they can tell you what infectious diseases were terrorized. They were in a permanent pandemic, and not just one disease, but dozens. People lost children all the time to all kinds of diseases, and vaccines have got us out of that. We, as our generation, we don't remember it because we didn't live through it, but now we are.
So my question is for Jamie. I know Nadine Miller is your public health director. My goodness, that lady over there is doing some really good work. How likely, speaking of the vaccine, what do you think is your community, your families, how likely do you think they are to take the vaccine once it's available?
Nadine is so wonderful and gets the flu shot for all our families, and it is amazing. These firefighters come and trucks, and they go through a school and bust these kids up and go to the next school. It's amazing. She gets so many kids to do that. So I feel like it would be received well. They make it free. All the parent has to do is sign a permission slip, and it makes it easy for the parents to have them done at school. So I think it could be extremely successful.
You think your community will embrace the vaccine and do, because I think that's the other part of this problem. Go ahead, Jamie.
I think so, based on the flu shots we've been doing every year since I've been here, and this is my 31st year in Mesa, but 17th in counseling, they're very happy and support that. So I'm hoping it'll have the same effect.
I want to just read it one comment. Is that okay? And Dr. Hummel, this is for you. It's from Monica Andrade Yen, and she says, did you see what happened to kids with Gardasil, little girls paralyzed from it? I will not be the guinea pig. There's her comment right there. What do you say to this? Because we've got a lot of naysayers.
Yeah, well, here's my attitude is that, look, for this illness, for this COVID-19, which is caused by the SARS virus, our best estimate in public health is that we will probably, if the vaccine is 90% effective, we'll need to vaccinate about 5 million of the folks in Arizona. There's 7.2 million people in Arizona. I'm confident that we can at least get probably 4.5 million people vaccinated voluntarily and easily, especially if it's convenient and free. As you press closer to that 7.2 million number, you're going to run into more and more people who are unwilling to get the vaccine, or who are what we call vaccine skeptics and require some in-depth conversation in order to get vaccinated. Fortunately, with this vaccine, I think if we get to 5 million, we will get to herd immunity, which is different than measles. With measles, you got to have something like 7 million out of our 7.2 million to be, or probably more like 6.8 million of our 7.2 million people immune to measles before you hit herd immunity. This disease is not as contagious as measles. So I'm not concerned about the skeptics and the people who are against vaccines, because I think there are enough people who will voluntarily get the vaccine and that are enthusiasts about getting the vaccine, and I'm one of them. So I'm just being honest. That's my attitude about it. I'm not that concerned, to be honest, because I think there are enough people who will enthusiastically or willingly get the vaccine, as long as you mentioned it needs to be free, it needs to be convenient, it needs to be easy.
Mitra commented earlier, and I thought that was a really interesting perspective. She said her son had meningitis and lost a child to meningitis, and a vaccine is now available. My entire family will be vaccinated. Parents, children can get sick and die. I unfortunately understand that because I lived it. Wow, thank you for sharing that. I mean, that's another perspective to the folks who are saying, no way, Jose, I am not taking this vaccine. Now, if we can just, I know Mesa has this awesome, robust way of getting firefighters to and from, schools like Slam Bam. Thank you, man. They are on it. But let's be real. Who is going to get the vaccine first? And when do you think it'll get to our children, to our school teachers, and our school teachers and counselors, just like Jamie, going to be considered the first line workers? Will.
I could tell you what the National Academy of Science, Medicine, and Engineering has recommended. The CDC hasn't come out with what they recommend yet, but I think that we can expect the very first doses of the Pfizer vaccine to be going out to healthcare workers with direct patient care, ICU trained nurses and the like, and also staff at assisted living and skilled nursing facilities, followed by residents of assisted living and skilled nursing, and then followed by elderly people, and I don't mean 65, I mean like 75 and up, and other people with debilitating conditions that put them at higher risk. After that, I think you start pressing into lower risk populations. The National Academy of Science and Medicine put teachers in tier 2. So there's 4 tiers. So teachers were in tier 2. So that I would guess that would probably be something like a March timeframe for teachers.
Jamie, I don't mean to put you on this spot, but how do you feel about being in that category, seeing the vaccine coming possibly, like Will just said, March timeframe?
I think it's positive because, we've heard a lot from people saying it's okay about the schools because kids don't get it and won't transfer it and stuff, but it almost feels like they're not thinking of the adults on the campus too. So it feels good that we are considered in that top tier to get it earlier.
Okay. I want to kind of change the subject a little bit. Let's go into sports because we know that the AIA is possibly going to cancel winter sports until January. Will, you and I had talked about this before when we saw the numbers rising specifically with the football teams. You had mentioned, sports, I think, is the one thing that schools could do away with in order to keep schools open. Do you still see things that way? And what do you think is going to happen with sports? I'm talking football, I'm talking volleyball, all of these winter sports. What we talked about, and maybe that was at least a month ago when we had that conversation, is look, you have to think through what's the community benefit for the activity that you have. And we talked about Superintendent Hoffman mentioning the importance of schools and the society benefit and the individual benefit that schools have, and weighing that against
the other things that are happening in the economy, for example, bars. And so you have to think things through in that way. Likewise, if you take the entire school environment and you say, what parts of this school environment are most critical to social, emotional, and educational development? Well, I think it's probably, other people may have different opinions. I'm all for physical activity, but I think the academic and the social aspects of school is more important than the competitive, especially the competitive athletic sports. Mm-hmm. That's just my opinion. And so I think with all these decisions, you have to look at not just the risks, but the benefits as well, and weigh the benefits along with the risks.
Mm-hmm. And JB, have you seen students completely change and come back to life, so to speak, as they come back to school at your school compared to how they were when they were online?
Oh, absolutely. I've had kids who would sing like canaries and talk, and I get them on a computer screen and I don't know. It's like, I know you're not shy. Talk to me. It's still me.
Talk to
me. It is much better to see him in person for sure. Nobody would doubt that at all.
Even with the masks on, right?
Even with the masks on, the potting. Really listen when the quiet ones, but yes, even with the masks on.
Yeah, it's completely interesting. That's for sure.
So do you think that the schools will remain open through December? Will, is that with the numbers that we're seeing, are we going to be able to keep our kids in schools through the end of the year?
I don't want to be a downer here, but I don't think so. I'm just being realistic. I mean, the trajectory of what's happening is troubling. We're on an exponential growth curve, just like it feels to me like June 12th. It wasn't an emergency on June 12th, but it wasn't easy. I mean, it wasn't hard to see where we were headed. And sure enough, early July, we were at crisis standards of care within our hospital system. Schools weren't in, so that wasn't an issue because it was summertime. But especially with the announcements yesterday, really, essentially, I'm not going to call them trivial announcements because I did like the mask. The health director put in that mask mandate for schools, which I think was, of all the things the governor talked about yesterday, that's probably the most useful. I don't think the airport screening is going to do much. These other things were $25 million for hospital staffing. I mean, that's not the kind of policy changes that would make a difference. And we're in exponential growth. And I just don't see how after Thanksgiving, or as you mentioned in December, that we're going to make it to winter break in person.
Would it be a good idea to, after November, after Thanksgiving, we do a 2-week virtual for everybody, or might as well stay virtual for the rest of December? I mean, in my head, I'm trying to figure out a way to keep, because people are going to gather for Thanksgiving.
I know it's like, well, if you remember, Memorial Day is what set us off with our summer epidemic, and you could put Memorial Day up against Thanksgiving. There's no comparison. This is it's like on steroids.
Yeah.
I want to throw this out there because I think it's important, and it's such a great question from Mary Detlef. She's saying, will my students have to repeat the school year? We know that question is probably better for Superintendent of Instruction, Kathy Hoffman. But I mean, Jamie, you're a counselor, Dr. Will Humboldt.
Yes.
That's a very fair question.
Very, very fair question, because we still have kids on remote who are not getting on the computers, even though Mace has done an outstanding job of I worked on getting Wi-Fi for everybody in our school who didn't have it. Every kid has a computer, but they're still not getting on. And, families are stressed, and some parents don't know how to help their student with online school. So we're worried about being behind. There's no talk at this point about having to repeat a school year, but, teachers do what teachers do best. They take kids where they're at and progress them from where they're at. So I think everybody's going to be of the understanding that these kids are going to be behind. There's absolutely no question, but I don't know if they're going to completely repeat the grade. There's no talk of that at this time.
But we're talking about years to come, not just, in the next couple of years.
True. Yeah, you're right.
Exponential.
Absolutely.
And Jamie here, Pinette said, I love my kid. I want to help him with his schoolwork. I want him to be successful. But I am not a teacher. I'm struggling with this. And in turn, he is struggling with this. I hear you right there.
That is as real as it gets, Jamie. Exactly. And
Thank you for sharing that.
Thank you.
Yes, it is true. It is true. And I think, when we first started the year remotely, we have a pretty good program that our district purchased for the remote, and trying to figure it out. So it's not all on the parent, they tried, my husband's a teacher in Mesa also, and he would stay online with every kid who was struggling because he knows. I mean, we were thankful our kids are older. I'm sorry for all of you, the young ones, but we would have been so distressed. We get it, and it is hard. And teachers are doing anything and everything they can to buffer that. And we're also, we're not counting attendance. So we're not dinging anybody for that right now because everybody understands. And there's some kids that I've tried to get on site so they can learn and help the parent, so they have some fears, but we're trying to do everything we can, and it's real. It's real. I think with all the negativity, anything we can do to just find that positive of focusing on gratitude, even if everybody in their family finds one thing that they talk about that they're grateful for. And I tell kids this all the time, even if it's, I had breakfast today, because some kids don't,
Yes.
If we can just focus on it and try to practice gratitude and grace, it's the best thing we can do right now. Understand.
I'm going to take
saying thank you. Yes, right. I mean, I just want to share this. Joy Graham is saying, and I'm so happy to hear this. One of my dear friends is a teacher, and she said, you have no idea how far a thank you goes.
Yes.
All the amazing teachers and administrators for doing their best during this unprecedented time. I know that they are all working overtime, and it's so.
And if we can leave it with that, I think our healthcare workers, our doctors, our nurses, our, the janitorial staff, sanitary staff, and Jamie, you and the teachers, I mean, my hat's off to you. You are my heroes. And I'm going to get choked up and teary-eyed.
I too. Thank you.
Because you're doing just so very much and giving us this, empowering us to feel like we're going to get through this. And Will, we can't thank you enough for joining us, for giving us your scientific perspective on all of this. Sadly, I know you have an outlook that we may go back to virtual as a state, but all we can do is do our own part, right? All I can do is teach my kids to wash their hands, wear their masks, and social distance. That's what I can control, Karla, in this little space.
Yeah.
I can't do what everybody else does. I wish I could, but I can't.
And just before we go, everybody, can we go back to the vaccine really quick? And I just want to reemphasize that, when we're able to get these initial doses to vaccine, if we can get that vaccine to the highest risk people that are the highest risk for hospitalization, even though it may take several months to get the rest of the population vaccinated, we will have done such a service to the hospital system that we can begin to have a lot more freedom because we don't need to have the restrictions in place because the most vulnerable will have been vaccinated first. And I am also very pleased to see teachers in that tier 2 group right after, elderly people and people with debilitating medical conditions, because you guys have done such an important job, and we've got to get the schools back open and create a safe environment for teachers, and putting teachers near the front of the line is a big part of how we can make that happen.
Thank you both for being here.
Thank you for your time. I want to thank everybody for their comments, the good, the bad, and the ugly. We appreciate that too. We're all in it together.
We really are. Thank you so much, and we'll see you back.